Getting close to retirement and trying to make sense of Medicare? You're not alone. Let's slow down and cover one piece at a time, starting with Part A. Part A is your hospital insurance. Picture it as the piece of Medicare that steps in when you need inpatient care. Here's what it actually pays for: a hospital stay, your room, your meals, and the nursing care you get while you're admitted, skilled nursing facility care, like recovering after surgery, rehab services such as physical therapy after something like a hip fracture, home health care, including nursing visits in your own home, hospice care for end-of-life comfort and support. So that's the coverage side. Now let's talk about what it costs, because this is where a lot of people get tripped up. Here's the good news first. If you or your spouse paid into Medicare taxes for at least 10 years while working, you won't pay a monthly premium for Part A. For most people, it's free. But free doesn't mean there's nothing to pay. You'll still have a deductible and possibly coinsurance. And here's the part that catches people off guard. These don't work like your old employer insurance. With most private insurance, you pay one deductible a year and it resets every January. Medicare Part A doesn't work that way. Instead, it's built around something called a benefit period. A benefit period starts the day you're admitted to the hospital, and it doesn't end until you've been out of the hospital for 60 days in a row. Let's walk through an example. Say you're hospitalized for a fall. You pay your deductible once, and Medicare covers the rest of that hospital stay. If you end up back in the hospital within those 60 days, you don't pay a second deductible. You're still in the same benefit period. But if more than 60 days pass before you're admitted again, the slate wipes clean. A new benefit period starts, which means a new deductible. And if a hospital stay runs long, past 60 days, that's when coinsurance kicks in. That's your share of the daily cost, and it goes up the longer you stay. It's a lot to take in, and it's normal to feel like you need to double-check the details for your own situation. Talk with your provider about what they're billing for, and always confirm coverage directly with Medicare. Since Part A doesn't cover every out-of-pocket cost, many people choose to pair it with a supplemental plan to help fill the gaps. And if cost is a concern, there are Medicare savings programs that may help based on your income. That's Part A in a nutshell, what it covers and what it really costs you. Stick around, because next we'll break down Part B and how the two work together. If this helped make things clear, hit subscribe so you don't miss the rest of the series.